Hey everybody, I'm Dr. Stephen Fallon. Welcome to my Facebook Live. This is, I guess you would call it Facebook Fridays. So welcome to Facebook Friday. I just thought of that this morning. And we're going to do a Facebook Live today. I'm going to share with you putties and stents that I use for preparation visits. I'm also going to discuss provisional techniques that I use using these putties and stents, and I think it's going to be good. The other thing that I'm going to do, which you can't see from here from my iPhone, I'm actually videotaping this with my 4K video camera over here, that side, and I'm going to multi-purpose the video into a dental excellence video because I figure the content will be really good, and I want to get it out there to people in my online community who are not also on Facebook, because not everybody is on Facebook. So I will try and answer some questions once I get through most of this, but I just want to so far show you my putties and stents. So right here, if you look here, this is the setup that we would have before a preparation visit. And this is actually a duplicate of a setup that I used on Wednesday for a veneer case. And if you look here, this is the, well, it's veneers and anterior jacket crowns. So the diagnostic wax up was completed on the SAM3 articulator. I would use the same setup for a full mouth rehabilitation case, an anterior crown case. This was a combination of crowns and veneers. So first thing that happens is Harold Heindel, my ceramist, he makes a duplicate model of the wax up using this putty here. So this is done in his lab. And then he makes this duplicate model. So here's the duplicate model. This is made with high quality vacuum mixed dye stone. Here's the putty. So they fit together nicely. And then we take this duplicate model here, and we make the different putties and stents that we want to use to prepare the case and make the provisionals. Now this putty here, this is actually very accurate. I could use this to make the provisional. The only challenge with making a provisional with a putty like this, meaning this one if you're on my dental excellence video, not Facebook, the only challenge with a putty like this is I can't see as I'm seating it. The good thing is it's highly accurate. The challenge is I can't see as I'm seating it, so sometimes they get hard to seat. Now when you're only doing 6 teeth, it gets seated and guided by the posterior teeth, so this isn't a bad way to go. And you can mark the midline like we've done here. But the other things that we make that are helpful, we use a Copyplast machine, and we make this, a BioStar machine, and we make this hard cast shell. So this is hard cast. You can see this is very detailed and accurate. And this is what I commonly use. You can see here in the Dental Excellence video stream. This is what I commonly use for provisionals because I could see myself seating it. The disadvantage with this is sometimes you could rock it and basically overseat it in the anterior. If you do that, your provisionals will be too short, which I know from experience. So we make 2 of these because sometimes if that happens and I pick up on it, I'll make a second provisional, so it's good to have an extra one because they get kind of covered in material, the provisional material inside the stent, and it's hard to reuse them. They get a little sticky. Now, what I failed to mention maybe is all of these are duplicates of what we used in the clinical situation this week. These are not what I used clinically. I had my assistant duplicate everything because I wanted to shoot the video without gloves on. So she, and plus we use them, they get damaged and cut up and can't really be used for a video like this. So this is a duplicate of what I used on Wednesday for that particular patient. So hard cast shell is the first thing. We use the hard cast shell to make provisionals. It's very nice because you can see the seating of the provisionals inside the shell. You can see the teeth, you can see the gingival margins. For me, it's a little easier than this. However, both work. If you don't have a Biostar machine, you can't make a shell that's quite this accurate with a Stay-Vac, so maybe this would be your solution. Use a relined putty of some form. For us, we like this. And let me show you, I'm in the office, so this is the actual material here. Hard cast from Great Lakes Orthodontics. And it's the 0.8 by 125 millimeter. And it works really well. I'm going to show it for my Dental Excellence video stream as well. So there it is. So this is what we use in the practice on the Biostar machine. In fact, for my occlusion design members, we created a video, my assistant and I, of her and I making all of these stents and putties. Actually, she made them. I kind of talked and narrated, but I videotaped it. So she was making all the different putties and shells. This is in Module 5 of Occlusion Design, as well as how we make the provisionals with the putties. So one solution to the overseating problem, sometimes you might have an overseating of the shell. One solution to that, especially with full arch cases or full mouth cases where you're prepping all the teeth and you have no reference points for the shell, there's two solutions. One is you include the palate. The problem with this provisional duplicate model, Harold didn't include the palate because it wasn't in here. So I have to talk to Harold. I've discussed it, but not clearly enough. I need the palette included. It would be much better if the palette was in there, because then I'd have more seating of my shells. So I'd have better seating of my shells. So that's one thing. The other thing that we could do, and I've shown this in the Occlusion Design members, for the Occlusion Design members, we can make this triad jig. So we take this triad provisional material. I don't use it to make the provisional. I actually use it, we just take it out of here. We form it along this before we take it off the model. And it makes a very rigid jig that I can use to help seat this. How it can help seat this without distortion. So the jig prevents me from overseating the anteriors. So that's what this is. And this is a really nice material. We cure it in the triad oven, and that works well. And I'm going to answer the questions in a few minutes, everyone. So feel free to ask questions. I see one good one right here that I do want to address. So that's hard cast shell. This is triad. I'm going to show it to the Dental Excellence stream. There's the triad. The next thing that we use, so that's to make provisionals. To guide the preparations, we make an incisal putty, okay? And this helps me, as you've seen if you've watched some of my preparation technique videos, this helps determine where the incisal edge of the existing teeth is relative to where we want to go with the provisionals. So this putty's really simple to make, easy to make. And then we make two of these putties, and these putties are for me to section and check the provisional preparation depth relative to the diagnostic wax up. So those are good. I'm going to actually give a little demonstration of what I do sectioning wise with these in a sec. And then we make this copyplast material shell. And if you look, my assistant has made a series of depth holes in this. A series of depth holes at the line angles and the midfacial for me to check with a periodontal probe and measure the depth of my preparation, again, relative to the outside surface of the diagnostic wax up. And let's show those for the Dental Excellence stream. So there's the incisal putty. There's the copyplast shell with the depth holes. So that's all of that. Now, copyplast, here's the material we use for that. That's from Great Lakes Orthodontics also. It's designed for the Biostar material we use, Biostar machine. We use the 1 by 125, so 1 millimeter by 125. And so that's the one we're using. And then for the putties, the putty that I'm using here, this green one, is Platinum 85 from Zermatt. And I was recommended this putty years ago by Pascal Magnier, so that's what we used. It has an 85 shore hardness. It's a nice putty, double mixed type of deal, and base and catalyst, and my assistant makes those. So last thing I wanted to show you before I discuss the Provisionals a little further is what I do is we actually section this. So that's why I wouldn't even show you the one that I used the other day because it's been destroyed. So what we'll do is, say for example, I want to check, well what I do is I start from one side and make my way over. So I'll check the cuspid first, so I'll section the putty. If the tooth has not had a lot of radical change, I'll section mid-facial, okay? And then I will check seating on the preps and see how the preparation outline form looks against the outline form of the provisional. So I'll section that, and then again, this piece is pretty much destroyed. So that's what we do here. Let's see if that'll focus on the Dental Excellence stream. I can make some photographs of this for that video. So we section this. Now here's the cool thing. Say the next tooth has a rotation and I'm concerned that I really want to check the preparation depth. So what I do there is I'll section this in 3 places. I'll section it on the distal line angle. So there I'm cutting through the putty all the way. And then I could check my preparation on the distal line angle, or the distal portion of the preparation. So that's here. Check that on the distal portion. And then once I've verified that's okay, I can section it mid-facial. Right here, it's just a smaller slice. So a nice small slice. I can't use this for anything, unfortunately, because it won't seat, but this will seat. So this seats nicely, and I can check the mid-facial. And then I can do another little slice and check the distal line angle. And I could do this with each tooth, but most teeth, if they're not rotated pre-treatment, I probably don't have to do this. And I've got a lot of experience at this, so I don't know that I have to do this with every case and every tooth in every case. But if there's a rotated tooth that I'm correcting, this is what I do. I section it all like this, you know, all of these little sections for those teeth. And that, I think, really helps. And you can see how this is pretty much destroyed afterwards. Now we make 2 of these because sometimes I section it and I want to go back and check again. So I'll have another one that I could resection. If there's one that I just decide that I want to section in a different location. The other thing is, if you're doing a full arch, by the time you get about 3/4 of the way through, you can't check the other quadrant. So having the second one, I could check the other quadrant. So the full arch cases, these get made all the way to the distal of the second molars. For anterior cases, they usually just get stopped somewhere around the first molars. But again, your assistant has to make this. It has to have a nice form in the inside, no pulls or voids. It has to be properly formed. That's the most important thing. So that's to help me with really precision preparation design. Precision preparation design, I think that that's very important. And as far as provisionals go, a couple of topics about provisionals that I wanted to touch on. Number one, we make this provisional in one of these shells. I remove it from the mouth and I remove the provisional from the mouth. That way we can contour the provisional properly and then seed it in the mouth. If we don't contour the gingival embrasures properly, you're going to get a lot of overhanging provisional material and cause inflammatory response, or more importantly, you'll blow out papillas and then you won't be able to have an accurate seeding of the final restorations. So that's one key. We want to take these out and then we want to contour them and reshape them and contour them really precisely in the gingival embrasure. The other thing is, the other key point, if we make the provisionals and we try to assess them, especially for aesthetic cases, the day that the patient is still in the chair, it's difficult when they're frozen, when they have lip anesthesia. So I always bring the patient back 1 to 2 weeks later to reassess the incisal edge position. Sorry, I'm going to move this. I always bring the patient back 1 to 2 weeks later with all aesthetic cases. Whoa, that's tipping. I always bring the patient back 1 to 2 weeks later with all aesthetic cases to reassess the incisal edge position that I'm building the case to. Because when they're leaving, they can't tell. Their lip doesn't have the correct lip mobility, and I could make decisions about the incisal edge position that are incorrect. So for me, I want to see the patient after they've had some time to reassess it and for the lip to become normal. And sometimes we overseat that shell and the provisionals are too short. And that happened to me this week. So my bottom line thought on that is I think we're going to make the triad resin jig even for veneer cases. It would have helped if we had the palette here, but I really have to get on Harold about adding the palette to these duplicate models. But the bottom line is I should have picked up on it. I was 1 millimeter short on my centrals. I had pushed the shell too much. And a millimeter is a big difference in smile design. So I have to get the patient in next week and add to the provisionals. I can't just say, oh, we'll add 1 millimeter to the final restorations, we'll be good. I'll tell you, I think that that's a perilous idea. I think that if you do that, you don't know what the smile design is going to really look like. You need to test the incisal edge position with the provisionals. I don't have it right on this case, so I need to redo the incisal edge position. And without that, we can't make a good judgment on what the final restoration should be. So, you know, this happens to everybody who does these cases. You know, you have steps that aren't turning out exactly the way you hope. And in this case, I overseated the provisionals shell. The provisionals are 1 millimeter shorter on the central incisors. I measured the model, compared it to the wax up, and she doesn't like it. It's too short. They look kind of short and too poor proportionately. They're too wide compared to the length. So I'm going to get her back next week, and we are going to add length to that. Now, the easy way to fix that, because I overseated it, all I have to do now is take another one of these shells, the hard cast shell of the provisional, I'm going to load about a third, the incisal third with the provisional material, and I'm going to seat it, and that'll add the length. Now, will that stay on? Not if I just do that. So what we're going to do to make that work is I will roughen the incisal edge of the existing temporaries with a diamond, just lightly roughen it. I've done this before, so I know it works. And add Optibond FL adhesive to the provisional. And then I'm actually going to use flowable composite because that will stick and be stronger than adding just provisional material, which will likely flake off. But flowable composite with Optibond adhesive added onto a Pro Temp Plus provisional sticks every time. I've done it multiple times because even if the diagnostic wax up is good and you seat the shell perfectly and the incisal edge position is what the wax up was, sometimes that has to be changed. Sometimes the wax up wasn't long enough, and when you get it in the patient's mouth and the patient isn't numb anymore, you realize I'd like more incisal edge position for that patient. So if you do, you know, this is something that you can use. You can reuse your shell and maybe just don't seat it as far and add the incisal edge position. Or in worst case scenario, you can have the wax up modified or added to on the duplicate model of the or on the model of the provisional, the existing provisional. Add to that, make another shell and use that. There's multiple ways to do this without having to take off the entire existing provisional and put it and remake it. I could do that, but that's kind of traumatic for the patient. I'd have to freeze her, I'd have to cut it off, I'd have to probably maybe repack cord in a couple areas. You know, that's a fairly aggressive approach to remodifying the provisional. Not probably that pleasant for the patient. So we can easily modify the provisional without having to cut them off. And if we don't have to cut them off, we don't have to freeze the patient. It's a fairly pleasant visit for the patient as opposed to something that's not going to be pleasant if you have to freeze her, cut them off, do all of that. So those are some tips, and The other thing that can happen is they're too long. If they're too long, that's really easy. You just shorten them. I could use a Softflex XT disc. I find that works really well. Here's a tip for that. I always shorten them standing. So I have them stand right in front of me, right here actually in this operatory. I move my unit, my dental unit up. I'm standing, they're standing, and I adjust it standing, because when I'm lying back, I might cant it slightly, adjusting the incisal edge position if I'm shortening, or I might shorten too quick. So when I'm standing, I have a really good view of the existing incisal edge position and how much to shorten if I'm doing that. Now lengthening's okay. Lengthening I could do lying back, because then I'd refine it standing. So I like to refine standing. I like to modify provisionals on the existing provisional. I find that ProTemp or any of those materials, if you roughen them a little bit, you add Optibond FL adhesive to the provisional, light cure it, then you can add flowable. It will stick. I've had them stick for months after doing that and look good. And those are tips that I hope will help you with your cases. That's the point of all this. Of course, point of my Dental Excellence videos. So if you like all of this, I'd encourage you to join my new webinar that's Altering the Vertical Dimension. It's kind of a case study webinar. We've had many people attend the webinar already and really enjoy it. I've put a link above this video if you'd like to register and attend. I think you probably will enjoy it. It's a really detailed training about altering the vertical dimension with case studies of 3 different patients. I'm actually in the office today. We're closed on Fridays. I'm in the office today. I'm shooting videos. I'm shooting kind of a follow-up video for the people that have attended the webinar so far, just answering some common questions that I thought were really good. There were a couple of questions that I didn't really cover that exactly on the webinar, but I thought they were worth re-answering or answering in a video. So that's the video I'm filming today. Everybody that attends the webinar will receive that video. It has some interesting ideas about taking the CR bite record, opening the vertical dimension, and kind of what's happening when you close from the PIC. There were some interesting detailed questions that I wanted to address. So everybody will receive that. I'm not sure when I'll edit and upload it, but it'll probably be within about 3 days. So if you join the webinar this weekend, you'd probably get it within a day or 2 of watching the webinar, I would guess. So the link will be above. We're offering it at a few different presentation times, one of which should fit your schedule. And let me look at the questions now. Oh, we've got a few. That's cool. Oh, here's a good one. I saw that right near the beginning. How do you cement when a combo of crown and veneer cases? That's an excellent question. And here's the deal. The veneers I prepped for this lady are ultra conservative. I hardly prepped the teeth at all. Maybe 0.5 millimeter of enamel reduction around the perimeter. And I didn't, I didn't really prep them down the palatal at all. They're really butt joint finish line on the palatal incisal, and especially cuspid. So I pretty much need to lock those on with flowable composite or a product called Neotemp. I'm using more flowable composite the last 2 years and spot etching for a case like this. So what we're doing is we'll spot etch near the incisal third. So a little spot etch. I use no adhesive at all. If you use flowable and adhesive, you're never going to get them off. And then you'll have to re-prep the teeth, which will add inaccuracy to your final porcelain restoration. So little spot etching, no adhesive at all. I use a little desensitizer on the preps. So Gluma desensitizer or G5 desensitizer. No adhesive, no Gluma bonding agent or anything like that. Just the glutaraldehyde desensitizer. So etch, no adhesive, seat the the provisional veneer restorations with just flowable composite inside them. And then we remove the excess and light cure, kind of a tacking technique like I've shown before in some of the Dental Excellence videos. Now here's the dilemma. We've got 2 lateral incisor peg laterals that need to be crowned, and we have a cuspid crown. So do we fill those with flowable composite and try and get those off, which will be very difficult. My suggestion is probably that's not a great idea. So you have to have a hybrid provisional. I do have the 6 units splinted to keep everything stable and to help them stay on. With provisional veneers, it's helpful if they're splinted. So we filled the other 3 units with polycarboxylate cement, so Duralon, which has good structural integrity of the cement. It's very strong, doesn't leak, really good material, but will come off reasonably well compared to the filling that with flowable composite. I think that's a mistake to fill the crown preps with flowable composite because you're going to have a heck of a time getting them off. Especially the 2 laterals had core buildups because I didn't like the way the preps were done on the peg laterals. They over prepped them and there were undercuts. So I did core buildups to try and better create the preparation design and just to help with the strength of the teeth. The one lateral was over prepped and I was concerned about it. So I did my core buildup technique on those 2 teeth. And with that, I definitely don't want to put flowable composite over my core buildup. It might stick. Even with just the Duralon, I put some Vaseline on the cores. So hopefully that helps. I think that was a good question. Rather use preparation stent. Can you cut through the mock-ups rather than using a preparation stent? Yes, of course. It depends on the case. This case, I had 2 previous crowns that I had to cut off, and a lot of bonding on the cuspid. So for me to make a matrix and cut through that isn't great on cases where you have pre-existing crowns you have to cut off. So I prefer not to use it in that case. I'd rather use these preparation stents. But I have a case I'm doing this week, 10-unit veneer case. It's going to be a tetracycline case. I'm exactly using that technique. We're going to make the mock-up, we're going to look at it, and then I'm going to prep depth guides in the mock-up, and I'm going to share that case with my occlusion design members for the monthly webinar. So both techniques are good. You need to have both because there are some cases where that particular technique using the mock-up is not awesome. And crowding cases, it's not great in lots of crowding cases too. Is it easy to remove the provisionals to contour them? Another good question. We coat the teeth in Vaseline before we seat the provisional shell, or the provisionals in the shell. So that helps with the removal of them. The other thing that I do is once I feel the provisional materials getting rubbery, I start teasing the matrix off. So especially with the clear shell, I can see that it's set and I can feel the rubbery material around the perimeter, and then I can just easily tease it off about 1 millimeter, and then we rinse it. Once it's off 1 millimeter, it's going to come off. I don't take it off all the way though. I take it off about 1 millimeter, I rinse, and then I seat it back in just so that the shrinkage doesn't prohibit it from being fully seated once it's set. But I don't want it completely exotherming or shrink wrapping on the preps. So I take it off about 1 millimeter, put it back on, kind of take it on and off as it's going through its exotherm while we're blowing water in there so that it doesn't overheat. So that's a good question. Never use the scent for actual add-ons. Nice tip. Yes, I think that's a cool idea. We've used that a bunch of times. It's something that I show during the monthly members webinars. And I think this case I will show because, you know, I overseated the darn thing. The provisional's too short comparatively to the mock-up. I can show you here. I don't know if you can see really well, but it's like it's 1 millimeter. It's 1 millimeter, and 1 millimeter makes a difference in the smile design. I can't go forward with the final restorations till I fix that. Okay, whoops. This little holder moves. Excellent. I accidentally made my provisionals very short, and the patient kind of grew on it and now wants the permanent veneers to be made the same length, even though it is not giving a pleasing golden proportion. Yeah, you know, the bottom line is you have to give the patient, you know, what they would like. However, what you could do is you could tell the patient, geez, this darn holder, I need to get a different one. You could tell the patient that you'll take the model of the provisional, the photos of the provisional, all the provisional documentation at the one she likes right now, but say, you know, I would just like you to test out a longer, more pleasing proportion. If you don't like it, that's great. We've got the records of the existing one that we have right now. If that gives he or she, the chance to test both, because they might like this one, but they might like the other one even better. So I would take the records of the one they like, and then use the tip that I said, make a stent, fill it in the incisal third, and seat it, and add to the length, and see if they like that. If they don't like it, it's no big harm. You can make it in the previous one, but it could be that they just don't visualize what it could be, and they'll like what it could be even better. So I would suggest maybe doing that. And okay, good. Spot etch works. Yes, I think that's a great technique. So yeah, that was lots of fun. I think it was about half an hour, which is kind of what I was shooting for, because I have to finish this other video for the webinar attendees with the questions, because it's I had a couple of really good ones that I wanted to address. And yeah, so thank you very much. I'll take another question if somebody has it. Otherwise, you can ask questions below the recording of this. Facebook posts a recording of this onto Facebook, my Facebook page, and watching the recording, if you have a question, just ask it and I'll answer it in the next day or so. I'm not sure if I'll be back on till later today, because I'm going to be working on a new video. And I'm also working on a video for my Velocity members, which will be released in a week or so as well. So I'm, busy working on videos. That's kind of what I do on Fridays, because we keep the office closed, so I could use it to create videos. I don't have a lot of other great places to make them. I could make them at, like, home in my cottage, but I prefer ideally making them here because all the equipment is here. So let's see, I think we're good. Okay, well, thank you very much, everybody. I hope you enjoyed this and learned some things. There's some good tips here. And again, if you're interested in larger cases and altering the vertical dimension, I would register for my new webinar. I think you'll really enjoy it. I've had great feedback from the webinar, and it's really a detailed clinical training. It's a detailed clinical training, and I think that everybody will really enjoy that particular training. So as my little holder of my camera goes down and I go down, that's hilarious. You can see my stents better now. As that goes down, I really need to look at that. I just bought this an hour ago as I was coming into the office. Quite funny. Before that tips down again, I think I'm going to call it a video. So thank you, everybody. Have a great weekend. It should be fantastic, I would think. And I'll talk to everybody soon. So thank you very much. Take care. Okay, so that's it for my Dental Excellence kind of hybrid deal between Dental Excellence and Facebook Live. It was kind of an experiment I wanted to do. Hopefully all of you enjoyed this. I forgot to say. I forgot to say that you can do this kind of dentistry, which I totally believe, and I've been proven this by members from my Occlusion Design membership. So you can do this kind of dentistry. Beautiful and precise dentistry is not just for the gurus. So thank you very much, and we will talk to you soon. Take care.